I'm Dr. Ken Goodman. Health maintenance procedures are designed to catch problems such as cancer or diabetes in their earliest stages, as well as to prevent certain illnesses from ever occurring. This video will discuss health maintenance procedures that are recommended for you now or sometime in the future. The best advice for when to do a medical procedure is based on a patient's personal medical history. Be certain to ask your doctor which of the following procedures may be right for you.
A mammogram is an X-ray examination of the breasts that is used to screen for problems such as a lump, cyst, or cancer. Many small tumors can be seen on a mammogram before they can be felt by you or your doctor. Now, this is very important because breast problems, including cancer, are best treated during their earliest stages. A mammogram cannot prevent breast cancer or even reduce your risk of getting it. However, getting regular mammograms can reduce your risk of more serious consequences by finding it in its earliest and most treatable stages. Mammograms are often uncomfortable but rarely painful. The entire procedure generally takes about 15 minutes. Many abnormalities found during a mammogram are not breast cancer. It is, however, important to follow up on even benign or non-cancerous findings to ensure that they do not change. If an area of your breast tissue appears to be a concern, further testing, such as additional views, an ultrasound, or biopsy, may be recommended. Be certain to keep up to date with your mammograms. Immunizations, also known as vaccinations, are highly effective in preventing many illnesses. Though not all immunizations are guaranteed to completely prevent the disease, they will often reduce the length and severity of the illness. Immunizations work by introducing small amounts of a weakened disease organism into the body, usually by injection. This prompts the creation of antibodies. Like a small army, they are then available to recognize and destroy the disease if you're ever exposed to it at a later time. Now, while most of us were immunized against several illnesses as children, it's important to keep up to date with our immunizations throughout our lives. The specific immunizations you need as an adult are determined by factors such as age, lifestyle, and overall health. Immunizations needed as an adult include tetanus and diphtheria, measles, pneumonia, and influenza, that would be the flu shot, and the hepatitis B vaccination, which is now routinely given to newborns. If not already vaccinated as a child, the hepatitis B vaccine is recommended for people working in the healthcare field, those who engage in high-risk sexual activities, and those who inject illicit drugs. Additionally, if you're planning on traveling out of the country, you may need other vaccinations. Be certain to ask your personal physician if your immunizations are up to date. Cholesterol is a fat-like substance found in some foods and also produced by your liver. Now, people with abnormally high cholesterol are at an increased risk of a heart attack or other heart disease. In addition to high cholesterol, major risk factors for heart disease include smoking, diabetes, high blood pressure, advancing age, and obesity. Not doing regular exercise and a family history of heart disease also put you at a higher risk. The more risk factors you have, the more likely you are to suffer a heart attack. Combinations of cholesterol and the proteins that carry it through the blood are called lipoproteins. High-density lipoproteins, also called HDL or good cholesterol, are protective to the body. Low-density lipoproteins, also called LDL or bad cholesterol, are harmful. Now, here's why. Excess bad cholesterol can join with other substances to form a plaque, which can dangerously narrow the blood vessels going to the heart. Think of it like rust clogging up the inside of an old pipe. Your cholesterol may become too high because your liver produces too much, you eat too many fatty foods, or you don't exercise enough. In addition, being overweight and getting older also raise the level. You can reduce your cholesterol by choosing foods that are low in fat, losing extra weight, and doing regular exercise.